We've got a lot of great health information to share with you today, but there's no better place to start than with our friends from Enliven Wellness. I am back with Dr. Leonette, and we are doing acupuncture. So we were going to show you guys at home all these different needles to kind of give you a visual of what the acupuncture needle is.
Right. You look a little nervous just having the needles over here.
This one.
So
yeah.
We're going to talk. This is a syringe that you draw blood with.
That's not a butterfly.
That is definitely not a butterfly.
No.
It's just the one you use for the arm. This, and you can see the size difference between the two. This is an insulin needle, so there's a huge size difference. And then acupuncturists, people are a little bit nervous of the needles.
It's so
I don't even know if you can see
really
that from the camera. It is tiny. It's way smaller than the insulin needle and syringe, and way, way smaller than the one you draw for blood with.
So do you feel it going in? Is it like maybe a sweat bee?
It's a very small little sting. In fact, this is about the same width as a human hair.
Oh, okay.
So you don't really feel it. Your pain fibers don't really pick up that much on when you put these in.
Very interesting.
Yeah. But we also have other options, which acupuncture isn't just about putting needles in bodies. It's taking those energetic points and amplifying them or allow them to put energy into it. So we have other ways. We actually have ear seeds. So these are just little seeds. They have a little sticker on the back of them, so we can stimulate points usually in the ear, and then they can stay on for a couple days.
Nice.
So I use this a lot for the Shinmin point for a lot of emotional stress. So people that come in with a lot of anxiety and they just need to kind of, or going through a real traumatic point, they just need to kind of calm down a little bit. We put these in there, and then they can go up and squeeze them over the next couple of days, and it just helps to lower that stress in the body.
So if you just want to come in and get some ear seeds, what is somebody looking at paying for that?
That's just, well, we do a full exam anyway. It doesn't matter what the case is. Do the full exam, and then we do the acupuncture. I think our acupuncture cost is about $70. Our exam's going to be a little bit more because we go through your vitals, case history, and the doctor spends a lot of time with you. So,
but that's not bad to fix your emotional health there.
Yeah, this really helps a lot. And then we also have these other needles that I kind of want to go over these too, because this is a big thing. These is at the VA hospital a lot for battlefield acupuncture. There's 5 points in the ear, and the studies with that show about an 80% reduction in pain for about 80% of the patients. So whether it's systemic or chronic pain, battlefield acupuncture has a really good track record for managing that.
Okay.
And then our last option is,
I'm excited for this.
For people that are a little bit more scared of it, we have a laser, and it's got a bright light. You probably don't want to look at that.
Right.
But we can do points like on your wrist. We can kind of go up and just hold on points like that.
And how long do you hold this here?
About 30 seconds per point, and it depends on what we actually need to work on with that one. Got like points like that. We'll do another point right through there. Do you feel any pain with that?
No.
Yeah, there's no pain. It will generate a little bit of heat after a while, but for the first 30 seconds, you don't really feel much of anything.
How does this work? How does my body pick this up? The energetic stuff?
Yeah.
Okay.
The laser just emits photons, lots and lots of photons, and each one of your cells has receptors in it. It's like a solar panel, and so your body takes that energy, and it's along these meridian channels that run from your finger into your head, and the ones from your toes up to your head too. So they kind of crisscross the body. So what we're doing is just basically charging up this whole channel that's running up all the way right through there.
Wow.
So,
that was painless.
Yeah, there is no pain with this one. It's a
Very cool.
really way for our skittish patients to get comfortable with acupuncture. So Leah's got the complaint of sinuses. This is one of our major things that we do with acupuncture. Okay. So at first I'm going to do some structural work on the acupuncture points, just add some vibration in on that, and then we're going to put some needles in there and just let her rest for a few minutes. But one of the first things we go is that we always check, the facial features to see where she's got some swelling. And it's pretty clear she has a lot of swelling here on that right sinus. So I'm just going to use this instrument. It's one of our chiropractic tools. And we're just going to stimulate some of these acupuncture points here on the top of the head. And we're going to go here to the stomach points. And are you feeling any pain with that?
No.
Yeah, there's just a little bit of vibration with that one. And then I also want to just check that nasal bone to make sure it's back in place. So we kind of mix in a little bit of structure work with the acupuncture. to make sure we get the right mix and balance that she needs. So then what we're going to do is just kind of prep up the skin here.
And what are you prepping with?
Just alcohol swab. There's no pain or anything, it just feels a little bit with that. And then we're going to use those really small needles we just showed a few minutes ago. Those things are tiny. And
how many are we using?
We're going to use 4. Did you feel anything with that?
No, I did not feel anything at all.
Now I can tell you when I push one in here, she's probably going to feel that one because with that sinus being
Don't cry on TV.
a little more impacted. It's,
it's just like a little pinch, not. It's no worse than if you have a tattoo.
I hope it's a lot better than if you had a tattoo.
My eyes water.
Yeah.
It doesn't hurt.
And how long is she going to leave these needles in?
We let people rest either about 10 minutes up to 30 minutes, sometimes a little bit longer if they need it. But what will happen, the eye oftentimes will water with that, and then she'll feel like a lot of the congestion and mucus start running down the back of the throat. So people don't really want to lay down there much longer than that because that mucus starts pulling as it starts moving up there.
But this is a good option if you don't want to take a medication for your sinuses or allergies. Then you can come here and get this done.
We've had a lot of people having to not take as much of the Flonase and things like that with that one. So we always like people to be as natural as possible. So are you ready to come up and see how well this goes?
Yeah.
All right, so let's just pull these needles out.
Can you feel them coming out?
I can feel it, but like the only way I can describe it is if your cat has whiskers and you're trying to pull the whisker.
Okay.
Like it doesn't hurt. It just is like a feeling.
All right, well come on up. Let's see how you feel.
Okay. I'm so close. Okay. No, I feel good.
You don't have anything draining?
No. Well, I have it it's draining, but
Down the
I
back?
don't have my glasses on, so I can't really get the whole effect of feeling. Okay, I feel a little off right now.
Yeah. A little lightheaded?
Just a little bit.
Yeah. That's a parasympathetic response.
Yeah. I can breathe through my nose.
That
I
fast?
couldn't this morning.
Awesome.